Well, good evening, everyone, and welcome. It's 7 o'clock, so we'll go ahead and get started. We would like to welcome you this evening to our Obstetrics Town Hall. My name is Katie Donahue, and I'm the Executive Director of Women's Services and Neonatal ICU Services, and I will serve as the moderator for this event tonight. I'd like to begin by saying just that we know these are certainly unprecedented times, but we are committed to working hard to maintain your safety while providing you a very positive and, most importantly, a very joyful birth experience. Our mission is and always has been for you to receive expert, compassionate care in a very safe and effective way that values your choices. We are committed to doing this and have been working continuously with our team to understand the most current recommendations and to modify our approach as necessary in order to keep up with these recommendations. This certainly is an evolving process where the guidance is changing frequently, so we are doing our best to stay current and to continuously modify our approach so that we can provide the most updated and evidence-based care to you, our patients. We do know that this is a very stressful time for you and for your families, but we are here tonight to answer your questions. We certainly aim to dispel any myths and hopefully offer you some peace of mind. Tonight's speakers will address these changes. They will also provide some background information regarding COVID-19, and then they will also talk through some of the changes to practice that are a result of this pandemic. We will go ahead, if we could flip to the next slide. I'll kind of just give you a brief summary of what the agenda will look like. So this is me, Katie Donahue, providing an introduction. We will have some updates via a PowerPoint presentation from our panel. And then following that presentation, we'll go ahead and we will answer some questions and provide some answers to those questions. Thank you to many of you who have submitted questions already. So we've gotten some insight into those questions. We've incorporated some answers into the slides already, but then we will continue to take a look at those questions and following the presentation, go ahead and continue to try to answer those questions to the best of our ability. So I will go ahead and introduce our panel. I will ask that each panelist go ahead and gives a wave when I introduce you. So first is Dr. Catherine Campbell. She is the Medical Director for Labor and Birth and Maternal Special Care here at Yale New Haven Hospital. Give us a wave, Kat. There you go. All right, next is Dr. Stephen Fleischman. Steve is the Associate Chief of Obstetrics and Gynecology for Yale New Haven Hospital. Then we have Jen Gerstein. Jen is one of our bedside leaders. She works on labor and birth and maternal special care here at Yale New Haven Hospital. Next up is Laura Sundstrom. Laura is one of our midwives working with one of our community practice Women's Health Associates. Then we have Amy Petroselli, another one of our nurses here, as well as she serves as the interim patient services manager for our maternity and newborn unit here at Yale New Haven Hospital. And then we have Dr. Christian Petker. Chris is our Chief of Obstetrics, as well as the Associate Chief Quality Officer for Yale Medicine and Yale New Haven Hospital. Chris, did you give us a wave?
I did, yep.
There you go. All righty, thank you. So we wanted to begin by just sharing with you, we thought it was important that we highlighted the fact that, you know, we are here, we're open for business, we are serving patients each and every day, and no matter the issue, we wanted to just highlight, you know, most recently, this was an amazing accomplishment that really had been in the works for almost 2 years of training here at the hospital. And this is where we were able to perform a surgery on a baby with a birth defect of the spine, which is called spina bifida. And this was done while the baby was still in the mother's womb. This woman is still pregnant and we are following her, but we were proud that we were able to do this very extensive surgery even during this challenging time. And for you, we just hope it continues to reassure you that we're here, we are here for you, and we want to provide the highest standard of care possible to all of you. All right, next slide. So we will go ahead, I'm going to transition the slides over to Dr. Petker. who will begin by providing an introduction to COVID-19.
Hi, everyone. I'm Chris Petker. I'm the Chief of Obstetrics, and I'm also the Associate Chief Quality Officer. And just like you, who've probably been consumed and preoccupied with the COVID crisis for the past 2 months, I've been consumed with it, and so has our team. And we've been spending a lot of time preparing for you to come to our hospital and have the safest and most pleasant and the experience of your desires when you get here. So for 8 weeks, we've been committing to creating a service that will meet your expectations when you get here, and we want to just take you through some of those things. So the next slide, Nelson, will covers what the symptoms are COVID, because I think it's on everybody's mind right now whether or not they have, or will get COVID. So we'll go through in the next few slides what that might be like. So basically, the infection appears to spread mainly through respiratory droplets, small respiratory droplets, such as when a person coughs or sneezes. And this is why we think that masks help so much in our contact with each other, and why masks help in the healthcare environment, especially the N95 masks. The symptoms that somebody might feel are fever, cough, shortness of breath, body aches, fatigue, malaise, and it's a lot like the flu. But one unique characteristic is some patients have a loss of taste or smell. Some patients only have that loss of taste and smell. They don't have a fever, they don't have the other respiratory symptoms, but it's a very specific symptom that people have. And we've had a lot of patients with just those symptoms and that we've tested and have been positive. This graphic on the right is a very helpful graphic that was produced by the folks at Yale New Haven Hospital that helps you tell the difference between if this is the flu, which we can test for, if this is COVID, which we can test for, or if it's just the common cold. And so there are some symptoms that are a little bit more unique to COVID. And there are some symptoms that are very rare with COVID, particularly sore throat and the sneezing and stuffy nose that we get with colds. Next slide.
Chris, I'm going to ask you to take a pause for 1 second. I'm sorry. I just want to make sure that everyone can see the panelists. We're getting feedback that possibly people can't see the panelists. So we want to go ahead and make sure that's corrected.
Great. We'll see if Nelson can figure that out.
That's actually on the Facebook side. They can only see the presenter and the slides.
Oh, okay. So for those of you on Facebook rather than on Zoom, you might not be able to see the panelists. So apologies. I think
once I stop the presentation, they will be able to see everybody.
Great. Thanks, Nelson.
Thank you. Sorry for the interruption.
That's great. So if you have questions, if you think you might have COVID or you think you might have been exposed to COVID, there are multiple ways that you can get those questions answered. First off, your obstetrician, your midwife, or your primary care provider are well equipped to answer these questions. And so you're contacting them, reaching out to them through their normal telephone lines is one way to call them. But the hospital, for the past 7 weeks, we're almost on our 8th week, also has a hotline that you can call that's staffed 7 a.m. to 7 p.m. every day, 7 days a week, where we have agents on the front line and healthcare clinicians, physicians, available to answer questions and do evaluations. We can also do video visits to answer your questions and to get you evaluated. And if you need testing, we can order testing through this hotline. So this is a very easy way for you to get your questions answered. And we answer all sorts of questions from people, including non-medical and non-clinical questions. You could call this line, and we've done about 70,000 phone calls over the past 7 weeks. And so we're ready to handle questions from you. Next slide. Some of the most common questions are not necessarily about, do I have COVID, or what do I do if I've been exposed to it, but mainly preparatory and prevention. And some of the best advice that we can give is for you to stay at home and adhere to the stay in place orders of the governor. Wash your hands often. Soap and alcohol both kill the virus. So a 20-second hand washing can make a big difference. Wear a mask. So there is a governor order to wear a mask in public and when you're around people. The utility of wearing a mask when you're alone, driving in your car, probably not so much. But when you're around people, wear a mask. Also, don't touch your face, or if you do accidentally touch your face, wash your hands after you touch your face. Limit your travel to the essentials, and this means picking up groceries, going to the pharmacy, going to your medical care. Avoid close contact with people, so practice social distancing, and if you're in places where you might be closer than 6 feet, make sure you're wearing a mask. And then avoid contacts with others who might be ill or carrying COVID-19, including those in your household. And you will get instructions from your healthcare providers on what to do in those situations. It's really important to listen to those healthcare providers. But it seems like people in Connecticut, especially pregnant women in Connecticut, are adhering to this. So this is about 3 weeks ago, we started a program at Yale New Haven Hospital where we tested all women presenting for childbirth for the COVID virus. We did nasopharyngeal swabs. And the reason why we did this is because our colleagues in New York City, where their data is shown on the right, had very alarming statistics. And they reported this in the New England Journal last week, and it's made a lot of press. It's made a lot of news. And you've probably heard about this yourself. But what it showed was that they had over 15% of their patients were affected by the coronavirus when they were admitted to the hospital. And alarmingly, 85% of those patients who were positive were actually asymptomatic. They had no symptoms at all. That was really alarming data, and we had early results from them. So we started our program about 3 weeks ago, and our data's on the left. And you can see that we have a very different experience at Yale New Haven Hospital. First off, fewer than 3% of our patients that come for childbirth are COVID positive. And a very small fraction of that, less than 1%, are asymptomatic. And so our experience is very different than the New York City, the Manhattan experience. And this is important for 2 reasons. One, it tells us that pregnant women in Connecticut are adhering to the social distancing practices, the hand washing, shelter in place. It's this data is striking to show that pregnant women are complying with that. The other thing that the data show are that it's very safe in Connecticut right now in terms of the epidemiology, and the patient population at Yale New Haven Hospital is very safe too. It's a small portion of patients with the COVID virus that are presenting for childbirth. And I hope that this data reassures you. Next slide. Our number 1 priority, and one of the major reasons why we did that universal testing policy, was to ensure your patient safety. So we've done 6 major changes to our service that really should help everybody feel better about coming to Yale New Haven Hospital and having their baby. The first one is that we do a screening on all of our patients and all of our visitors. This is across the whole hospital for symptoms and for fever upon arrival. The next thing we do is what I told you about on the last slide, where we're testing all of our patients admitted for childbirth for the COVID virus. The third thing we're doing is we're limiting our visitation. Now this is happening all across the hospital where most patients are not allowed visitors, but on labor and birth, we're limiting to 1 support person, and that support person is being asked to wear a mask. We've also created an OB COVID unit that we're calling the Obstetric Comprehensive Care Unit. And that's a special unit. We're one of the only in the United States to have one of the only hospitals in the United States to have a specific unit dedicated to taking care of patients with COVID, patients and their families and their newborns. And we'll hear a little bit more about that later. Then we do staff screening. Temperatures are checked twice a day for our staff, and all of our staff are wearing masks. And then we've joined services. We've consolidated our service from our St. Raphael's campus, the Venome Birth Center at St. Raphael's campus. We brought them over to our York Street campus so that we can pool our knowledge and our resources. And that's really so that we can support our obstetric care unit and create those services together. Next, Steve Fleischman. Dr. Fleischman will present a little bit on the prenatal care enhancements that we're doing around the community.
Steve, you're muted.
Helps to come off mute. Thanks, Chris. First, I just want to say on behalf of the medical staff at Yale New Haven Hospital, we have over 100 obstetricians and midwives that practice here. Congratulations. For all of you who are excited about having a new baby, a new addition to your family, I just want you to know that all of us here at Yale are just as excited as you are for bringing you to the hospital and having a wonderful birth experience. And we are committed more than anything to making sure that the experience that you have here at Yale is the experience that you were hoping for. So a couple of things that you should know: in the community and across our services, we have over 13 practices and different service lines at Yale New Haven Hospital that serve all over Connecticut. We have over 30 office locations. We have providers as far out as Essex, down to Westport, and up to Wallingford. And all of those offices are still there to take care of the needs of our pregnant patients. We are still going to be proceeding with in-person visits. You may be noticing that some of those visits are spread out a little bit more, but we still believe that those in-person visits are an important component of your prenatal care. But we've added some things, and I think you'll find that there's some more telemedicine visits being offered. We're doing a safe, convenient way to receive some of the prenatal care. We're offering remote blood pressure monitoring, and in some cases, giving people pulse oximeters to check if they're not feeling well. It's really important for all of the offices that we want to involve your partner or support person in your care. And while we're not allowing people to bring someone with them to the office, understand that we're all willing to do whatever we can to make that experience as good as it is for you and your family through FaceTime, Zoom, or whatever means that you want to have your partner with you during that visit. So we really are excited. I know that this is a stressful time, but we in obstetrics love being a part of one of the most exciting parts of your family's life. And so we continue to be there to support you. And we're taking the necessary precautions that are needed in the outpatient and inpatient setting to make sure that you have a safe and wonderful birth experience. Next slide. And I think I'm turning this over to Jen Gerstein.
That's right. Hi, everyone. I'm Jen Gerstein. I'm one of the labor nurses here at Yale New Haven Hospital. And as far as our perinatal education program is concerned, it is still alive and fully functional. It just, like everything else in the world now, has gone online. So we have online offerings of cesarean birth, childbirth education, breastfeeding classes, and newborn care that are completely online. And then in addition to that, we're adding in Zoom classes. So you can take a Zoom class for your childbirth education, questions about the pediatrician, breastfeeding basics. But what we're really excited about is that we're also changing the way we're doing our maternity tours. So traditionally you would come into the hospital with a very large group of people, and we would take you through the hospital and give you all the information about your stay here at Yale New Haven. And now what we're going to do is have that as a Zoom tour so that you still have the opportunity to ask all those questions that you have and to interact with us and have the visual cues of what it's going to look like when you come here, but all this can be done from the safety of your home. So on the bottom of the screen, there's the information about the website and where you can find all the details on that. And we are totally here to help you with all of your education needs. It remains really important to us. And we know that that's something that everyone is needing. Can we go to the next slide? Okay, so we have always acknowledged that every woman's birth is really, truly unique. And we know that when you come into your childbirth, you have this idea of what it's going to be like, and then you have a pandemic hit. And we really want you to know that not everything changes. We are still really focused on giving you the absolute best birth experience that we can give you. We are working really hard to make sure that we keep you and your baby safe, but we're going to work with you. We're going to share in your decision making. We're going to partner with you to really get you the kind of birth that you want while also keeping you safe here. And Dr. Petker spoke to how many safety measures we have in place. We will make sure that you are safe to come here and have your baby and still have it be that special experience that we've always prided ourselves on giving you. To the next slide. With all that said, there are some changes, just like everywhere else in the world. So our patients and visitors are not going to be out in the hallways too much. We're going to try and restrict them into the rooms, but if you or your partner needs anything, the nurses are there to bring you whatever you need. We have room within the rooms. We have a beautiful unit here. We have room for you to walk around in the room. We have different positioning devices like birthing balls and squat bars, and you're still going to be able to do all those things that you would do normally, but we'll have you be in the room. We still have our tubs and our showers available. Hydrotherapy is totally fine during the virus at this point, from what we know. And while we can't give you nitrous anymore, we still have medications available and anesthesia available if you needed some help with the pain. So please don't be nervous about coming here. We are here to work with you hand in hand to make those decisions to help you get through your birth in the best way possible.
Hi, everyone. I'm Amy Petroselli. I am the Assistant Patient Service Manager, actually the Interim Patient Service Manager of the maternity unit here on York Street campus. And so us on the postpartum unit, we've kind of wanted to try and make sure that we do our best to keep your postpartum experience as close to business as usual as possible. But with this time of COVID, we have had to adjust our visitation a little bit. So each of our moms, we're asking that they designate one support person that will stay with them during their entire hospital stay. This designated support person, we ask they stay in the room with mom during the whole stay. They try not to leave at all. We do have meal services that can be delivered right to the room so that mom and her support person can share meals together as well. Our lactation department is up and running and offering full lactation support to our patients while they're here in the hospital. They also are continuing with their outpatient support clinics, and they're doing that through telehealth right now and will see patients if needed in person. Discharge, we're continuing to keep our patients up to date and prepared for discharge as we were. The discharge process continues to be a shared decision making with your obstetrician, your midwife, and the pediatrician, just to make sure that you guys are ready to go home. Typically, discharges remain 1 to 2 days after a vaginal delivery, and then our C-sections are usually discharged between day 2 or day 3 after their C-section. We've have had a couple questions come in about car seats. So our current support for car seat is that we encourage you to bring your car seat in when you come in to have your baby so that we can help you place the baby in the car seat, check the straps, and make sure that you're ready to take your baby home with you. And then heading home, we continue to encourage you to socially distance. Stay at home, don't leave your house unless it's absolutely necessary for those things like Dr. Petker said, grocery store or for doctor visits. If you can have somebody deliver groceries to you or use a delivery service, that would be great. The other thing that we're encouraging is no visitors at this time. And so we're just encouraging you to use your technology that you have to FaceTime with family members, to check in with them, see how they're doing, allow them to see the baby during this time. Okay, next slide, please. And I believe we're going to pass this along to Dr. Kat Campbell.
Great, thanks, Amy. All right, so in thinking about COVID and how we can make our hospital safe for you when you come in for your delivery, we've done a lot of things to make sure that this happens. When you come into the hospital, similar to before COVID, we ask that you call your OB or your midwife to let them know that you're coming into the hospital. This is especially important now with COVID because in addition to asking you about the baby, about the pregnancy, and what you might be coming in for, we'll also be screening you for symptoms of COVID, or if you've been exposed to someone with COVID. So that when you come in, you can be met by a nurse, and you'll be escorted upstairs to a room that's going to be safe for you and your labor support person. All patients who come into the hospital will be masked, and your visitor too. You can bring your mask from home that you might be wearing out in the community. If you don't have a mask or you need a fresh mask, we can provide that for you when you come in. And know that when you come in, if you know that you have COVID and you have COVID symptoms, or if you have the universal screening and testing when you come in for your delivery hospitalization, if you're diagnosed with COVID, we are especially prepared to take care of moms who might have COVID during their delivery hospitalization. Next slide. Great. So we have taken care of several patients who've had COVID, either prior to their delivery, during their delivery, or after their delivery. And we have been able to create a unit specifically to take care of moms and babies during their obstetrical care in the hospital and during your delivery hospitalization. We call this the Obstetric Comprehensive Care Unit, or the OCCU. And if you're diagnosed with that, with COVID, we would have you come into this unit where we are set up to keep you safe during your delivery hospitalization and keep your baby safe. Some of the things that patients have been asking about is, can I have a labor support person? And the answer is an emphatic yes. Even with COVID, you can have a labor support person. We will be screening your labor support person just to make sure that they don't have symptoms of COVID. There are exceptions to visitors being able to come in for deliveries, but also there are restrictions. So for example, your labor support person can't have an active COVID infection and support you during labor. We do rely on a lot of video technology during your labor and delivery course, and that has actually been working very well for our patients, and that's something that we would introduce you to early if perchance you had COVID while you're in the hospital. The good news is your delivery team is the same. We have the same nurses, same midwives, same doctors taking care of you if you happen to have COVID during your labor and delivery course. And so you're going to get that same personalized care with the same providers that you got to know during your prenatal care. Another big question is separation of the baby after delivery. So the CDC does recommend, similar to if you had influenza, that the baby be separated from the mom after delivery. Obviously, this is a very big decision, and it's not something that we take lightly. We would work with you and discuss in detail what this means, and also get your feelings about this, and we would come to a decision that you felt comfortable with. That separation, if it occurs, the baby would be in a room next door to you, and you would identify a healthy caregiver to help care for the baby until you are recovered from COVID and able to provide that, that intimate care to your newborn. Breastfeeding is strongly encouraged, even if you have COVID. The one difference would be that you would either pump or express the milk and have that healthy caregiver feed the baby while you're recovering from COVID. And then obviously during this time, we would spend a lot of time educating you and your family to what things look like when you go home, especially if you're still recovering from COVID. And you would work with your OB, your midwife, and your pediatrician to set up what things look like at home and what your follow-up appointments look like. And I think this might be the last slide, and we're going to transition to questions from all of the attendees.
Great, thank you, Kat. All right, so we are going to go ahead. We have many questions that have been posed both currently throughout this presentation, and we also have the many questions that were submitted prior to the beginning of the presentation. So I'm going to go ahead and just start to kind of move through those, and we'll do our best to get to as many questions as we possibly can. So I think first we will start with, how is the hospital supporting natural childbirth? Laura, do you think you could speak to this for us?
Sure, I'd be happy to. Hi, everyone. My name is Laura Sundstrom. I'm one of the midwives. I've been at York Street campus for a while, and prior to that, I was a midwife at the St. Rainfields campus. So on behalf of all of us working at York Street, I want to first take a moment to welcome everyone who had planned to have their baby at our sister campus at the Vidone, who's now with us. It's a big change in what you were thinking about. We're happy to have you. And Yale, in both campuses, has been committed to supporting natural, when desired, normal physiologic birth whenever we can do that. So in many ways, nothing has changed in that regard. We'll look different with all of our personal protective equipment, but you're going to come in, you're going to do the hard work of having a baby, we're going to love it, and we're going to thank you for giving us that little bit of normal that we really crave, while we as healthcare workers are taking care of all of this craziness. So it's really, we're doing what we've always done. If it's safe for you to be off the monitor and walking around your room, we want that. If you want to be in the tub, we want that for you too. If you want to have your baby in any number of positions, we've got you. The things that you've been wanting in terms of your normal, well-supported birth are the same really now as they were prior to the COVID crisis.
Thank you, Laura. There are many questions coming in about masks and who needs to wear a mask, when they wear a mask, and do you need to wear a mask throughout delivery? I'm wondering, Kat, maybe this was kind of tapping into some of the information you shared related to someone being COVID positive. Do you mind walking through who does need to wear a mask and when they need to do so?
Sure. So an easy answer to that is that everyone should be wearing a mask when you're having person-to-person interactions. And so that's true for all of our healthcare workers as we interact with visitors and patients alike, and it's true for you. When you're a patient, though, that can get a little complicated wearing a mask. And so most of the time as a patient, you will not need to wear a mask because you'll be in a room, you'll be with your labor support person, and the door will be closed. And so there'll be plenty of time where you can be mask-free. There might be times during your hospital stay where a healthcare worker might ask you to wear a mask. For example, that might be when you're transitioning from the labor floor up to the postpartum floor, and you're asked to put a mask on during that transition. These recommendations might change, but for right now, we'll be very flexible with you, let you know what you need to do to stay safe, and also keep your labor support person safe while you're here.
All right, we are also getting a number of questions related to nitrous, whether it is, one is seeking the answer to why the nitrous was discontinued, why we can't use it, and if we're considering bringing that back. So I don't know if Kat, you and or Chris maybe could help answer this question.
I'm happy to start with that. Nitrous was discontinued because of the concern that having that mask on with the nitrous gas can actually do something called aerosolize viral particles. And so for that reason, we discontinued the use of nitrous, and that has been throughout the country. That is a uniform recommendation. And when the COVID epidemic is settling down, or when we learn more information about the virus, we'll bring nitrous back. We want to do that. We want to make sure that everyone stays safe.
I'll just add to that the reuse of the equipment, because it's a closed system that you're breathing into, using it from patient to patient, we can't necessarily know that using it from patient to patient is safe. So that's another reason why we're restricting its use. We don't want that to be a hazard for our patients.
Thank you. Okay, what should I do if I am pregnant and experience symptoms of a respiratory illness? Steve, would you mind answering this question?
Sure. if you're feeling any symptoms, you don't think that something is normal. Some of the symptoms of COVID, a little shortness of breath, is very common as you get later in pregnancy. But any question you have about any of these issues, you should call your primary provider. So whoever your obstetrician, your midwife, whoever you see on a regular basis, like I said, the offices are open. We want to hear from you. If there's anything that makes you a little more nervous than normal, there's no problem picking up the phone, calling the office, and we're happy to talk you through it. And if we think you need COVID testing, because that's a concern, we can order that testing and get that done for you.
Okay, thank you. There's a question about individuals providing care to COVID positive moms and whether or not they're going back and forth between the rooms of COVID positive patients and COVID negative patients. Maybe Chris or Kat, would you mind responding to this question?
Sure, I can start with that. So we all wear proper PPE in caring for patients during their hospital stay. And that's true if you have COVID or if you don't have COVID. So in patients who are diagnosed with COVID, extra precautions are taken in wearing additional protective equipment to help minimize any spread of the virus. And so use of that PPE is what is actually stopping that from happening. And so yes, providers may be caring for a COVID patient and caring for a non-COVID patient, but we consider that to be safe because of the use of the PPE. And also assisted by our universal testing program, where all of our patients admitted to the hospital for delivery, we know if they have COVID or not, whether or not they have symptoms.
And what we've done is we've created a separate part of our unit, a separate part of our hospital really, that's located near the labor and birth unit, but it's a separate part. We created this special area where our COVID positive patients are taken care of. And it's by strict infection prevention principles with negative pressure rooms and the PPE that Dr. Campbell was talking about. That limits the exposure of other patients who come in healthy without COVID, limits their exposure. So we've one of the few hospitals in the country to be able to do that.
Great, thank you. I'm going to group a few questions together related to newborns. Should newborns be kept in isolation for a specific period of time? There's questions about kind of how we care for the baby. Is the baby separated? Are mom and baby kept together? So maybe Amy, can you begin kind of responding to what that looks like for the care of the baby for maybe both a COVID positive mom and for a mom without COVID?
Sure, yeah, absolutely. So for our moms who are tested and are tested and they test negative, it's normal routine postpartum care. It's our desire to keep moms and babies together. So in those cases, our babies and mothers room in together in the room on our postpartum floor. And with our moms who test positive for COVID, like we had kind of mentioned earlier, is that we do follow the recommendations of the CDC, which is to separate. But with that said, we do continue with the shared decision-making model. And so we will present you with, what the recommendations are that we have, and then we'll talk to you about kind of what your wishes are. And then we will formulate, a plan together as a team so that we can make a plan for you and your baby and your caregiver that, meets everyone's needs.
Katie, you're muted.
Oh, sorry, thanks. Thank you, Aim, sorry. We have a few questions related to testing. So Chris, can you maybe speak to the testing process, who gets tested, when that happens, and then whether or not partners are tested?
Great, thank you. I've noticed a lot of questions on testing. So we're testing all patients on arrival for childbirth. So this would also be patients who have cesarean deliveries that are scheduled. When they come for their pre-op appointment the day before, we're doing the testing at that time. Otherwise, when patients are coming in labor or for their inductions, we're testing them then. It's a nasopharyngeal swab. So it's a swab that goes into the back of your nose, and it's done by a nurse or your doctor or midwife. That test gets sent to our laboratory, and our turnaround time is generally within an hour, sometimes 2 hours, but it's anywhere from 30 minutes to 2 hours. We get the results back very quickly. We are not doing testing of partners right now. We don't feel like that there's much utility in doing that, particularly because we think the risks of the exposure is mainly with the patient who might be huffing and puffing in labor, and that's the main issue. Also, we're asking that the partners wear masks, and it's a little bit easier for the partners to wear masks during the delivery. We're not generally testing newborns, particularly on negative patients, but we do work with the pediatricians on what should be done for newborns for COVID positive mothers. And then we're not routinely doing the antibody testing either. Right now, there's not really an FDA approved test for antibody testing, and we're not offering it for our healthcare workers or for our patients, the antibody testing, because we don't know much about what its utility is, what the strengths and weaknesses are of that test. So I hope that answers most of the questions.
Great, thank you. Okay, we have another question. I am worried about coming to the hospital because I am worried about COVID. I am considering a home birth as an option to lower my risk. Can you help me decide between my choices? Maybe Laura, would you mind responding to this question?
Sure, I'd be happy to speak to that. So one of the important questions that families ask themselves as they get ready to plan for a birth is, where do I feel the most safe? And that's a question that each individual family is going to answer. And many people are going to choose that they want to be in the hospital for their birth. And if your choice throughout your pregnancy has been to plan for a hospital birth, the hospital is the right place for you to go. You've heard from the panelists already the measures that we're taking as a team to ensure our own health, to wear protective equipment to help protect you. So your risk of contracting COVID when you come into the hospital to give birth is very, very low. And you're also walking into an environment where you're still going to be supported. You'll have your familiar care team and have those elements of your labor and your birth that you were seeking to begin with. So in my opinion, the COVID outbreak does not change where you should intend to have your baby. If a hospital birth is your plan, as most people will plan, you should continue with that plan.
Thanks, Laura. There's another question here that maybe we can add right on to you here is, I had been planning to work with a doula. What should I do now?
We are thrilled when women tell us that they're choosing to work with a doula. And I think it's been a real hardship for families who have planned to have a doula with them at their labors and their births to not be able to have that person physically present. And I think it's a real hardship for doulas who desperately love working with women in labor and are now doing this thing that we're doing. I think it's important to remember that a support from a doula doesn't just start when you come in for the hospital, that doulas are there for their clients throughout the pregnancy, helping them to navigate what their wishes are and their preferences are. And right now, with so much baseline stress that everyone has, it's really important to have another person who you can help make decisions with and to answer your questions. Jen, did you want to talk a little bit about how doulas are working with their clients once they do come in labor?
Yeah, sure. So we have a really good working relationship with all of our community doulas. They help us a lot, but we can also learn from them. All of the labor nurses have labor support skills. We do this every day. It is what we love to do. And we're finding that some of our community doulas are actually working either via FaceTime or via Skype. And so I'm still having births with all of these doulas that I've been working with all along. It's just on a little phone instead. But there's so many ways that you can still include your doula, and not even your doula, but your other support people too that are important to you for that birth, because we really want you to have the people there that are going to help you have the best birth, but they can't be physically there, but we're welcome to have people on FaceTime and we're happy to kind of hold the phones and have them share that experience with you.
Thanks, Jen. There are a number of questions related to circumcisions. Are we doing circumcisions here at the hospital? Seems to be the general theme. Would someone like to maybe respond to that? Kat, or maybe
Yeah,
Steve?
I'm happy to take that one. So yes, we are doing circumcisions. We're doing circumcisions on babies born to moms who don't have COVID. And in babies who are born to moms with COVID, once those babies have their COVID swab, then yes, we're able to do that circumcision too.
Great, thank you. Let's see. There are many questions. We're trying to do our best to group these so we can get as many answered as possible. There's a few questions related to discharge. One question is around kind of, are we forcing people out, it sounds like, very early? And then the second is, can I go early? So maybe Amy, could you just speak to, in general, what the process for discharge looks like? And maybe Amy and even Steve, and how we decide who can go when.
Sure, yeah, I can start. So our discharge process is very similar, has not changed for a COVID positive mother or for a COVID negative mother. Our typical discharge days for our vag deliveries are days 1 to 2 after birth, and then our C-sections are typically day 2 to 3 that they're discharged home. Again, the decision for discharge is made on with many different things. We have a discussion with your obstetrician or midwife. We have discussions with the pediatricians. We have discussions with you to make sure that the day that we are sending you home, or the day that you wish to go home, that you feel like you're ready, you're supported, and that you feel like you have enough tools and ready to take this little baby home with you.
Yeah, I don't know if I have much more to add to what Amy just said. I would agree. It's a decision that we make with the family. So if you're ready to go home and you feel like you'd rather be at home with the baby and you feel like you've had all the sort of education, time with the lactation consultant, and the things that we're looking for in the postpartum period, we're happy to send you home earlier. But we're not looking to rush anyone out of the hospital. So if you need time, if you want to spend time with the lactation consultant and didn't have a chance to do that, or you feel like you need a little more support from nursing staff in the first the second 24 hours, we'll discharge you when you feel like you're ready. And that's always a decision that we make together, patient, family, pediatrician, nursing staff, and whatever works for you and your family is what we decide.
Great, thank you. Steve, I have another question for you. My OB provider has suggested less frequent prenatal visits or visits over the phone or via video. Is this safe?
Yeah, so it's a great question. And when this started, I think it caused a lot of us to look at what's being done sort of everywhere around the country. And interestingly, in many places, less frequent visits are commonplace. And so I think, certainly early visits early in the pregnancy to establish care, but some of the intervening visits where really we're not doing very much other than potentially checking the blood pressure. We have you go for your ultrasound, or maybe a little bit further on when you're feeling fetal movement and you can, that the baby is moving around in there. There's not much we add in those visits. And so spreading them out a little bit has really been something that hasn't changed really the overall prenatal care. We've at Yale New Haven, most practices have adopted a similar sort of spacing schedule. And interestingly, it's the same schedule that's being used out in California for routine prenatal care long before COVID was even an issue. So I think it's completely safe what we're offering. And in some cases, it's made it easier for patients to schedule their visits.
Great, thank you. All right, there's a few questions around C-sections. So Jen, maybe I'm going to ask you to respond. The questions are, I have a scheduled C-section. Is there anything special I need to do? And then there are some questions related to whether or not the patient having a C-section, can they have a support person with them in the operating room?
Okay. So really our C-section program has not changed drastically with this. The only addition that we've really had is that you will, like was mentioned earlier, is that you're going to be tested for COVID when you come in. So traditionally, when you have a C-section, you're brought in for a quick 20-30 minute visit the day before your surgery, where we will draw your labs, we will ask you health questions, kind of go through all of the procedures the following day so you know what to expect. All that is the same. The only difference is when you come in for that visit, then we'll do your COVID swab then, so that we have your status going forward for the next day, so we know what your status is. We haven't changed being able to have a support person there. We still want you to have the same kind of birth, but it helps us guide where that C-section is going to take place, because we have that separate unit and we have a separate OR set up for cesareans if moms are positive. So you'll come in the day before, you'll have your testing, and then we'll have that information to proceed with the C-section.
Great, thank you. All right, we have a few questions related to breastfeeding as well. So I plan to pump my milk. What if I pump more than my baby needs? Are we able to store milk in the nursery at this time? Is one question. And then another is it safe to breastfeed? So, and then also can COVID-19 be transmitted during breastfeeding? So maybe Amy and Kat, could you both try to work on responding to these breastfeeding questions?
Sure. Kat, you want to go first or do you want me to?
Why don't you go and then I'll follow.
Okay, sounds good. So yes, right, we do have a breast milk refrigerator in our nursery, or newborn procedure room as we call it, where we can store any excess or extra breast milk for any of our patients. So there is a spot for us to store any breast milk that you may have while you're here in the hospital. And then is breastfeeding safe? There has been a very limited amount of studies surrounding breastfeeding and COVID, but those studies that have been done show that there is no COVID virus detected in the breast milk. So we are encouraging breastfeeding right now by pumping for our mothers who are COVID positive. We are recommending that they pump their breasts, and when they get their express breast milk, that express breast milk is fed to the baby by a healthy caregiver at this time.
Great. Yeah, so I would just echo what Amy said. So we are encouraging breastfeeding for all new moms, even if you have COVID. So the good news is we have not seen the virus in breast milk yet. Obviously, we're very early in the pandemic and learning about COVID, but it doesn't seem to be a way that this virus is spread. So that's good news for new moms who choose to breastfeed. The concern and the reason why we encourage the breast pumping or the hand expressing and then the feeding from a healthy caregiver is that the virus can be on your skin. And so that's the reason why that is the primary recommendation. But I would echo again that if you have COVID and you're getting some counseling from your pediatrician and your obstetrician, that this is a shared decision and your questions will be answered, and the plan of care that will be developed will be something that you feel comfortable with. No one's going to force you to do something that you don't feel comfortable with.
Thank you, Kat. All right, we do have a number of questions. We'll just try to address this. It's somewhat related to the visitor, but a lot of questions around, can the visitor leave the room? Can the visitor get food? Can they go to the cafeteria? So maybe Amy and Jen, can you respond to how we work with the visitors and what they are allowed to and not allowed to do while here with an inpatient?
I can start with that. With the patients, we want the visitors to stay in the rooms, but they are still allowed to go out of the room down to the cafeteria if mom is COVID negative. If she is positive, we would prefer that they stay in the room with her, and they're actually able to order trays from our dietary services into the room so that they're not stuck in a room starving for days, but they're allowed to have meals brought to them, and they can go down. If you're negative, you can still go down to the cafeteria, out to your car to get something. We just ask that you wear a mask anytime you're out in the hallway.
Yeah, and I would second exactly what Jen said. Up on the postpartum floor, same exact rules apply. So we do for our COVID negative mothers, the dads are encouraged to stay. They are offered a companion meal 3 times a day. So they can order that through our room service option here in the hospital so that they do not have to leave should they not want to. But if they feel like they need to go grab a cup of coffee or something else from the cafeteria, they are more than welcome to go and do that. But like Jen said, we do make sure that they wear a mask when they're leaving the floor. And again, for our mothers who are COVID positive, we ask that the support person, if there is one with them at that time, to stay kind of sheltering in place, as we like to call it, and not leave the room. And we will also offer companion meals for them as well.
Great, thank you. Dr. Campbell, do you mind responding to the question about a patient with a poor OB history?
Yeah, sure. So, I think a lot of what is being said tonight, we're talking about routine labor and birth and routine pregnancies. We all recognize that that is not typical for everyone. And we do take your pregnancy history into consideration. And if you have maybe something like hypertension or diabetes, or maybe you've had a stillbirth in the past, we take that into consideration in setting up a prenatal care plan that's going to work for you. And so that might not be the typical one that we're using, and it might be modified to meet your needs during the pregnancy with more frequent check-ins. Maybe you need more frequent evaluations, and so that should be addressed during your visit with your midwife or with your obstetrician.
Katie, can I just comment, because there's been a bunch of chats about the spacing of visits, and I want to be clear. It's safe to space visits out, but we recognize that every pregnancy is a little different, and everyone comes to pregnancy with a different experience in the past. And so if you're nervous, if you have a little extra fear because you had a bad pregnancy outcome in the past, by all means, discuss that with your obstetrician or your midwife. And we are making exceptions on a regular basis. We just say that we can space them safely, but we want you to feel safe in pregnancy. We don't want you to leave and feel nervous that you haven't been in for a while. So if you feel uncomfortable, make sure you speak with your obstetrician or midwife. We accommodate changes in these schedules all the time. So don't feel like you can't say anything if you're told to come back in 8 weeks. Tell us, I can't go more than 2 weeks without hearing the baby's heartbeat, and we'll bring you back sooner. It's not an issue.
Great, thank you, Steve. There are a few questions I want to try to, I'm sorry we can't get to all of the questions, and we are thrilled that so many people were able to participate, and we will really give some thought to how to get through these questions and provide some follow-up to all of you. There's some questions related to when do we see an end? Will this still be going on in July? Will this still be going on in August? So I don't know if Chris or Steve, who would like to respond to this question, but it's just kind of the unknown.
I think it's very unknown. We're tracking it really carefully, and we're tracking it in many different ways. For instance, this testing that we're doing on all of our patients, it's allowing us to track what the prevalence is in the community to see if COVID's coming or going, because we can take a snapshot of what is it like to be a pregnant woman near term or at term giving birth, and how many of those patients are affected. And I think we're going to be able to know, is it getting worse or is it getting better, by the data that we're getting there. And we also have a ton of hospital and health system data. We hope that this is all temporary. I think that there might be changes that go on for a while. We might be wearing masks for more of the care that we give throughout the summer and throughout the fall. And that might change permanently forever. We don't know what that will be like, but hopefully the changes that are permanent will be smaller changes. We're hoping that the St. Raphael campus will be restored with birth facilities. I think that that would be a really important way for us to state things are going back to normal. But for now, right now, we have the Vidone Birth Center at the York Street campus, and we're honoring everything that patients wanted from the Vidone Birth Service at our York Street campus. So I hope that people know that we're trying to keep it as normal as possible. But we'll have to see how things go. People should know, though, that we're tracking it almost weekly. And the things that we've taken away, we want to give back just as soon as possible. And we'll do that by tracking things so closely.
And there was one more question, Katie, which I thought was a great one. which was, have we seen any babies named anything special for the coronavirus? And I will throw that out to the group, but I have not seen any really great names yet. So if you have some, throw them up on the chat. We'd love to hear about them.
Yeah, I haven't heard of any yet.
There's one more question I just want to try to close the group, because I know that this is, there's so much stress associated with COVID, and the babies are obviously, everyone is very concerned about this, what this means for these new little babies. And so there was a question about someone who's, refusing to be separated from their newborn. So can we just one more time review kind of what that looks like if someone is COVID positive? What does that shared decision making look like? And are we forcing moms and babies to be separated? Maybe Amy and Kat can kind of tag team that response.
Sure. So, that conversation is going to start while you're still pregnant. We're going to know the results of your COVID test when you come in for your delivery. And so that conversation will start then. I think for some patients, maybe that decision will be a little easier, and for others it might be a little more difficult, and that's okay. So that will start with your nurse, your obstetrician, your midwife. Your pediatrician can get pulled into that conversation too. And really it's a weighing of risks, benefits. Obviously how you're feeling is going to be taken into consideration. If you have a case of COVID that you are needing time for yourself to heal from, that decision might look very different from someone who comes in and so we don't expect that conversation to be made in an instant, and it sometimes might be made over the course of hours. And we would anticipate that we have that plan when your baby is born. Sometimes moms come in and labor happens fast and babies are born quickly, and so that decision gets sped up, and that can be made with the baby in the room, or it could be made with the baby taken to the nearby room, depending on what the mom feels comfortable with. And then we would continue that as we move into postpartum care. But I'd want to reassure you that this is not something that's made just by a provider. It's made with a team and in a partnership with your providers and yourself, and that you come to a decision that you feel comfortable with. Amy, do you want to add to how you guys, what you're doing on postpartum?
No, I think the way you had put it was very well. Everything that you said, I would echo. It's definitely a partnership that we have with our patients. We are all involved in that decision, and we want to make a decision that our patients feel like we're being supportive to them. So, we're all about trying to, weigh the risks and the benefits, and kind of seeing where mom is in her illness is a lot to take into consideration as well. So we're going to make a decision that works best for everybody, and taking everyone's wishes into account.
Yeah, and I would say no one is going to remove your baby from your arms against your wishes. That would never happen. And we would never support that type of those types of actions. And so this is shared decision making, and it's done in a calm way that expresses understanding and coming to a solution that you feel comfortable with.
Absolutely, I definitely second all of that.
And how soon after delivery will the pediatrician see a baby?
So a pediatrician will visit the baby and mom and dad as well within 24 hours of birth. So they have 24 hours to come into the hospital, examine the baby, meet with the family, and start talking about newborn care and get the kind of discharge discussion going as well, and kind of welcome them to the practice and their ways of doing stuff in the practice.
Great, thank you. So we are over past 8 o'clock. So sorry that we were not able to answer all of these questions. Like I said, we will take some serious time to review these questions and see if we can come up with a creative way to address these questions for you, and figure out how we could publish those so that there's no questions that remain unanswered. But again, I'd like to thank everyone. Thank you all for your participation. Thank you to our panelists for your willingness to sit and kind of field these questions. And everyone stay safe, and we wish you much luck. Thank you.
Thank you, everyone. Thank you, Katie.